Good afternoon, ladies and gentlemen. Welcome to my show, Lifestyle with Dr. Moby. I'm Dr. Moby from Washington, D.C. We have a great guest tonight, and we are welcoming Dr. Shahrukh Qaisrani from Lahore, Pakistan. But before we start into formal introduction, I just want to again emphasize we are dealing with pandemic COVID-19 all over the world. It's really affecting in Pakistan right now. There are a lot of cases reported every day, and it has peaked almost to 175,000 cases with about over 3,000 deaths. So that's a big number to go by, and we worry about this pandemic. And the main emphasis is how to deal with that. And we are lucky to have a frontline provider today, and we'll deal with ask about these questions and see how people are dealing with and how being professional at frontline they are dealing with. And once again, we give salute to all the frontliners, whether they are medical doctors, nurses, even hospital staff. They really sacrifice a lot of their time as well as their precious life. Unfortunately, we have lost a lot of doctors there, also in Pakistan or also in US. So this is really something which has taken a lot of toll on everybody's life. So let's welcome Doctor. Welcome to our program. How are you doing?
I'm doing fine. Good afternoon, Dr. Mobeen. How are you doing?
Good, good. Tell us about your uh, where you practice and tell us a little bit about yourself.
Yeah, I'm Dr. SHAHRUKH Qaisrani, and I'm working as a Part 1 resident physician
Mhm.
already in Lahore General Hospital
Okay,
in Lahore, Punjab, Pakistan.
okay, very good. And tell us how do you right now? I'm sure you're dealing with a lot of COVID patients. What is your right now work schedule? Do you have to cover every day or?
Yeah, the work schedule is extremely hectic and it's not light at all. I mean, there are patients coming in every minute, and it's so, sad to see all these deaths, by the minute.
Yeah.
And we just it breaks my heart and breaks everyone's heart because we are working on the front line, and it
Okay.
just breaks our heart to see the people losing their loved ones every minute. So we are just head over heels and just maintaining uh, just one more breath of every patient. All right, we're head over heels in trying so that the patients can survive. So
Mhm.
it's just really sad when we lose someone, although we cannot, literally save each and every one, but we still try our best so that we can save maximum number of people. You know,
Mhm.
so
Yeah,
that's like the work over here. Yeah,
and that is probably true. That's the hardest part is for any doctor or any medical profession or anybody is or anyone to see somebody dying in front of them or helpless that we don't have actual treatment. We have a lot of supportive treatments, and we have. So again, comes to the important question. Prevention is the best strategy. Um,
exactly.
so how do you think? What do you find when you talk to a lot of these patient families? What do you find where where they could have done better?
All right. The thing which I believe is the CPI actually. All right.
Mm,
The CPI, according to me, means the care, C for care, the
mm,
P for prevention, and I for immunization. All
mhm,
right. This CPI holds an essential level in the care of management of COVID patients.
mhm,
All right. But as you see, there are a lot of cases in Pakistan as well as in America. But when we actually see the case fatality ratio, all right, the
mm,
case fatality ratio is basically the number of deaths divided by the number of cases. All right.
mm, mhm,
When we get a ratio of that, that ratio is very low. What that indicates is that the people who are recovering, those are at a much larger rate than the ones who are actually dying. Although there are many cases which are being registered, but there are still a lot more people who are recovering than those who are actually dying. So, in my opinion, CPI, care, prevention, and immunization,
mm,
is it holds a great footstep in for patients who are recovering from this infection.
mm. And I've talked to a couple of patients in Pakistan, and here also same thing. They have this kind of concept that no, this is COVID means somebody on vent or something like the on those lines. So they ignore if you have respiratory problems and fever. They think it's just a minor cold. They never thought it would be COVID. So do you find that kind of basic understanding lacking among family members?
Yeah, today, of course, there is a lack of understanding, not just amongst the family members, but also amongst the doctors as well. All right.
Mm,
Because this is actually something new for all of us. All
mhm,
right. We're dealing with something which we've not experienced before, although we've experienced the strains of coronavirus before as well. All right.
mhm, mhm.
Strains of coronavirus have hit us before. If you look at the history of mankind, there
Yeah.
have been two epidemics before in the mankind of coronavirus. All right,
Yeah.
but they were not in the form of a pandemic such as this SARS-CoV-2 virus. So it is natural to not have an understanding, a great typical understanding about what this actually is, and I believe that's okay. So one must have a high degree of suspicion these days, especially when he has a fever, when he has myalgias or pain in the muscles, he has dry cough and he has fever, he has headache, lethargy, insomnia. So one must have a high index of suspicion, the doctors, physicians, and the family members, that it is 80 to 90% COVID these days. All right, don't just treat it like a case of influenza or any other thing, because if you suffer from these symptoms which I've just told you, just consider it to be COVID these days, especially because one needs to hold a really, really high index of suspicion these days.
Mm.
So yeah.
So what are the testing facilities? How good they are right now? Do you think that people can find some testing or providers can?
Yeah, testing facilities are being developed day after day, all right, as we continue to grow to progress to understand this virus in a better way. Uh, some of them are the baseline tests, such as the CBC, which is the complete blood count, the LFTs, RFTs, a major test, which is a procalcitonin level. That holds, a very high
Mm,
index of diagnosing this infection. When a physician, he can get confused whether it is COVID or a bacterial infection, then procalcitonin levels can help differentiate whether it's a COVID or a bacterial infection, because procalcitonin levels are significantly raised in COVID. So apart from that, when it involves the different body functions, then LFTs, which is the liver function test, or RFTs, renal function test, they also can get deranged. So you can get a derangement of the baseline level test, a derangement of the procalcitonin levels. Then, of course, we have the PCR testing, we have the ELISA testing. They are also very, very good in diagnosing this infection. And then the nasal swabs, of course, just they give a hint in diagnosing this. So yeah, we're moving towards a brighter future in which we'll be able to diagnose this in a very quick way.
mm. And do you think media plays a very important role in education, especially everywhere, but in Pakistan, there was a lot of media reports about wrong kind of treatment as well as wrong approach towards COVID. They were basically discounting COVID and saying, "Oh, it doesn't exist, and this is all just hype." So, what do you think media was really responsible for some of these misconceptions?
Yes, exactly, Dr. Mobin. This is a very, very, important point which has been emerging, of course, these days. Just before highlighting any of this, I would like to show you a slide of one of my studies which I've been conducting now, which just shows the amount of depression that people have been facing due to
Mhm.
excessive media usage these days. Would you be kind enough to show that?
Sure, sure.
Yeah.
Asim, if you want to put the slide. Okay, so not the next
No,
one.
no, the other one. Yeah.
Yeah.
Yeah, of course.
Okay.
This one. As you see over here in front of, this is a research just in the completion phase.
Hmm.
And as you see over here in front of you, this actually shows the amount or the statistical analysis of the
Hmm.
psychosocial impact of media on the people in the form of depression.
Okay.
All right. So over here, you see that the people who have clicked the agree button is actually a lot higher. All right. So people are actually agreeing to the fact that media is escalating the amount of depression caused in them. All right. So uh, one needs to limit the time that they spend on television, and one needs to just spend some time with their family members instead of actually using the media for a longer period of time. Apart from television, these Facebook, YouTube, and other WhatsApp and Instagram stories, they just create memes. All right, the youngsters, they just create memes, and they just forward these memes, and these memes, they do not portray a good image
Mm.
of the society. All right, so this is actually creating a havoc. So instead of spending too much time these days on the COVID post, just avoid them. All right, because this is escalating a depression level to a much larger extent.
Mhm. Yeah, yeah, and I think we are. You're right about depression phase. So, how to, there was also some lockdown, and I know with quarantine also people get depressed. Um, what do you think? How to people should maintain some of their lifestyle or keep them in good spirits while in lockdown?
Yeah, this is a very important question, actually. A healthy mind and a healthy body, all right?
Mm.
These constitute a healthy lifestyle. I mean, just being physically okay does not mean you're okay.
Yeah.
Apart from being physically okay, you need to have a right state of mind, all right,
Mm.
in order to function properly.
Mm.
So, a mental health, which I just showed you, you need to avoid your time usage on the media in order to keep a good mental health these days. And apart from that, it is actually important to keep a good physical well-being. All right,
Mm.
and in the physical well-being, you can just maintain a healthy lifestyle. Just set a time limit. All right, when you get up in the morning, just make a schedule of the day, schedule of the day of what you're going to do throughout the day. I mean, you're not just going to lay around, and you're not just going to watch TV all day. All right, just keep on watching the number of cases increasing day by day. I mean, that's not good at all. Just make a routine of what you're going to do exercise, engage with family members, engage in healthy activities, engage in indoor games. All
Mm.
right, so just avoid going outside these days. I mean, everyone's literally talking about this concept of social distancing these days, of how much it's important. It's so much important in curbing this infection, that if we do not maintain the social distancing, it will keep on rising. Just believe me, it's not going to finish. It will keep on rising until it plays a havoc everywhere. I mean,
And
America has already started facing the crisis. I mean, what else do you expect? I mean, 1 lakh deaths over there. All right,
yeah,
so that's a pretty big number.
yeah, 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 that's definitely, a lot of cases here in US, and like you say, it's about 100,000. But I think you're right. But good thing is here people at least try to do some social distance and preventive measures, which was good. I think in Pakistan it was actually better at first, and then suddenly they just forgot all everything about it, and then they had Eid, and then they had prayers, and then all of a sudden the numbers are like through the roof. So those are
Yeah,
definitely
exactly.
is I think what is also hurting, which I've seen here, a lot of uh, patients tell me, and they get bored. They are losing patience, so they are becoming so impatient with all these that they just want to continue, just ignore it, just completely ignore it, and like if it does not exist. But virus does not get bored with that, and it doesn't care. we get
Yeah,
bored with it,
exactly.
is gonna be still there. Okay, so whether we realize the
Exactly.
reality, is up to us. So if anybody wants to take a chance, just remember, it is like threatening, and it can kill you for sure. It's not a regular flu, which people think they will just, oh, it's okay, no problem. Well, there is a problem, and but best is prevention is always the best. You can't just have things, there are no treatments, and then let's talk a little bit about one of your slides. You said there is some about some studies you want me to look at for.
Yeah, yes, of course. In the immunization schedule, although we are not expecting a vaccine anytime sooner, all right?
Mm,
So we have to depend on nutritional supplements uh, for our betterment. In those nutritional supplements, one of the important minerals that is needed and that is essential these days is the mineral zinc, all right? So zinc is really very, very much important. And just if you would put up the slide, no, the other one.
first one.
Yeah,
Yeah, this.
yeah, actually this one. So basically, in order to, before proceeding on to this slide, I would just like to explain an anatomy of COVID-19 a little bit, all right? So that people can understand this mechanism a bit better. Now,
Mhm,
the virus which we are inflicted upon these days is actually the SARS-CoV-2 virus, all right? The
mm,
SARS-CoV-2 virus, it enters the cell. Okay, it's an enveloped virus. It's an enveloped virus, and it is a single-stranded RNA virus.
mhm,
When that virus enters the cell, all right, so it needs to get replicated so that it can infect other cells, all right. So before the replication begins, there is an enzyme. I'm sure everyone knows the concept of enzyme. So the enzyme, that is the RNA dependent RNA polymerase, okay, that creates copies of the RNA genome of the virus. Simple as that.
mm,
Now, what does zinc do? All right, that zinc, it enters the cell membrane and it helps to block the RNA dependent RNA polymerase.
mhm,
Okay, and as it is blocked, it prevents the replication of the virus, and subsequently it prevents the virus from infecting other cells and ultimately the human being as a whole. So you see how much important this zinc is in helping to maintain a good immunity, because it actually limits the limit of the enzyme, which is the RNA dependent RNA polymerase.
mhm,
So one must take a good nutritional supplement consisting of zinc. Along with zinc, one must maintain a very good diet consisting of citrus fruits, which are the oranges, watermelons, and all the types of berries, the strawberries and the cranberries. And apart from that, one must also have a good nutritional supply of vitamin D3. All right, because it has been seen that people who have a deficiency of vitamin D3, they progress faster to the worrisome complications of COVID. So
mm.
maintaining a good zinc level, good uh, vitamin D3 level, ingesting certain citrus fruits such as the oranges, and apart from that, just keeping a good healthy diet and a balanced diet including proteins, carbohydrates, and limited amount of fats. So that constitutes a balanced diet.
That is so true. So I think Doctor really gave us a good advice about zinc. Now, zinc is also available over the counter, and you can get it a tablet or
Yeah.
very well. But also, there are certain foods which are rich in zinc. So you can, if you are more believer of that, feel free to take those. Vitamin C is very important too, which is important component, like he mentioned. So vitamin C, you have to eat citrus fruits, and remember, vitamin C is water soluble, so it is not stored in your body for too long. So which means that you really can run
Yes.
shortage, and then it's very important. You need to keep up that vitamin C nutrition. Third is about
Yes.
your vitamin D, which is very, very important. Also, now recent studies showed that people ended up with a lot of complication who were low on vitamin D levels. So those are very valid points, and I think he really nicely, very simple way showed how zinc is effective, and there's a role of zinc with this COVID, and also actually there was some studies about flu also.
Yeah, a certain time ago, there was a drug actually, which you might know as the chloroquine. All right. Now, this chloroquine and the primaquine, these are actually the anti-malarial drugs. All right. Chloroquine, it can also be used as an anti-inflammatory drug. All right. So, although it was initially to some extent popular, but people and the physicians have not been advising this drug, anymore because of its certain effects on the heart and its certain effects on the eyes. So, just a brief mechanism. If some physician does suggest you to take chloroquine, if you would just put up the slide, Dr. Mobeen, I would just
Yeah,
like to
yeah,
explain the mechanism. Yeah,
yeah, sure.
yeah, yeah, this one. This is actually a slide demonstrating the chloroquine action along with zinc. Now, you see that zinc basically that is uh, that is a helping agent. All right, it helps in finishing of the enzyme activity of RNA dependent RNA polymerase, just like I told you a few minutes before.
Mm,
Now, it needs some agent, all right, to enter into the cell, all right, an agent in the form of an ionophore. Of
mm,
course, if one takes zinc, all right, if one takes zinc, that zinc just cannot go into the cell by itself. It needs, some type of a travel agent on which it can travel inside the cell. All
mm,
right. So that chloroquine actually is the traveling agency for zinc. So that chloroquine, just transports the zinc inside of the cell membrane. All right, inside
mm,
of the cell membrane in which the virus has entered, and then the zinc can actually, demonstrate its effect. Although now this chloroquine, I'm using a simple term, the travel agency. Now, in medical terms, we use the term ionophore. Now,
mm,
chloroquine acts as an ionophore for the zinc. All right,
mm,
it helps to carry the zinc inside the cell. Now, since many physicians have not been prescribing it anymore, so one may take other nutritional supplements along with zinc. Whenever you go to a doctor, he may prescribe other medicines, all right, along with zinc. So those medications are actually helping the zinc to enter the cell and to exert its effect.
mm.
So zinc is, beneficial as a whole as well. Also, it helps to exert an extra effect in the presence of certain other medications which your physician might prescribe you. That those actually help the zinc to enter inside the cell. So
And
yeah,
that is so true that the and it is COVID is very interesting in many aspects. Certain treatments, like doctor mentioned, some people will get benefit with one, some might not. So yes, there were some people who responded to chloroquine, and then there were, but now it became controversial. So there are other medications which we can also use. Some suggested doxycycline, and
yeah, doxycycline and nowadays, dexamethasone.
dexamethasone,
People have been, yeah,
dexamethasone for people who are sick enough to be in
with severe, severe
hospital.
enough infection.
So and same dexamethasone, don't give if it's outpatient only, because you can cause more problem. So it's very important to look at the context. So lot of patients actually, they might respond to one treatment or the other depending on their
Yeah,
response. And then there's a great article in Lancet about now why different treatments work and why they don't work
and
on all. And I think it's fascinating that how this virus really made it. I mean, it's a small virus, but still it made such a big impact in everything. So it is very, very. great learning in that sense, that we always
Yes.
learn new things about human body and how it functions. So I think with this, with it was pleasure
Yeah, Dr.
talking to
Mubin, yeah, Dr.
you. Go
Mubin,
ahead.
just before finishing, I would like to mention a very important concept, all right, for the people to learn as a whole.
Mm,
So this is a very important concept, which is the herd immunity, all right?
yeah. Mm,
So we don't see the vaccine coming anytime sooner, as WHO has, just
mm,
announced. So what we need to keep in mind is actually the concept of herd immunity.
mm,
Herd immunity is basically when 60 to 90% of the people get in some cases infected and then get immunized automatically, or if they get the vaccine and then get immunized in that case, all right.
mm,
If 60 to 90% of the people get immunized, then they can offer an immunity to the rest of the population who have not yet contracted the virus.
yeah.
So, I mean, in the years to come and in the months to come, I must say, if the vaccines are here, then that's an excellent point. That will, rapidly progress the way towards achieving a herd immunity. But if not, we can, just consider remaining inside and not going outside, maintaining social distancing, and with time, this herd immunity is going to develop in those who are actually recovering. All right, they're not dying, but they're recovering, so they will have antibodies. They will have antibodies, and ultimately, a time will come that they will procure a herd immunity to the rest of the population who are not yet infected. So that's an important point that everyone should keep in mind.
That is so true. Now, it's also it's
Yeah,
fascinating that this virus is actually like any other coronavirus. Those antibodies, I read a recent study that those IgG, even antibody levels, were wearing off after 3 months or 4 months, and nobody knows that those levels going down are still protective or not. And is it going to behave very much like any flu in that term, that you have to every year get a new vaccine? My guess is
exactly. Yeah.
probably right. And then because it's after all a coronavirus, so like any other coronaviruses are. So those are it was pleasure talking to you. And for audience, let's summarize if you have final points to say, Doctor.
Ye- yeah, sure, Dr. Maveen. I mean, life is precious, right? Life is precious, your life and your loved one's life. All right, everyone's life is precious. So just like Dr. Mobeen told a few minutes ago, that people actually are bored of staying indoors. I mean, do you actually find boredom in staying indoors, or you actually find boredom in lying on the ventilator table? So those are two different scenarios that you have to keep in mind. If you want to save yourself, and if you want to save your loved ones, and if you want to save those around you, all right, it's essential these days to maintain social distancing, wear masks, and wear protective equipment, personal protective equipment. Everyone should follow these protective measures, and they should, wash their hands minimum for at least 10 to 20 seconds, because that's the minimum amount of time that coronavirus takes to get dissolved in water. If you just wash your hands for 5 to 6 seconds, that's not going to have a very huge impact on the coronavirus being dissolved in it. All right, so just maintain healthy habits, maintain a good hygiene, maintain good nutritional supply of different vitamins and minerals that I just told you, and just religiously follow the medications that your doctor prescribes you, because in these times doctors are the frontline warriors, and they are the ones who are the superheroes. All right, the Spider-Man, Superman, and all these superheroes, they're just in the movies. We are the actual heroes nowadays. So just help us, if I must say in simple words. The more you help us, the more the situation is going to get better.
Yeah, thank you for those great words. And same, I would just re-emphasize, it's always important to take care of yourself first, whether you're a healthcare provider or not, but your life is more precious than anything around you. So just pay attention to your health and lifestyle, And keep watching our channel. Give us feedback, Twitter, email, whatever you like. And thank you for watching our show. And thank you, Doctor, for this great opportunity, giving us a great talk. Okay,
Thank you
well,
so much, Dr. Mubin.
you take care. Thank you. Thank you.
Take care.